Good evening, everybody. My name is Jim Valenti. I'm President and CEO of University Medical Center of El Paso, and I'm here tonight to help host this public meeting and help explain our new bond issue that we're talking about to expand our outpatient clinics in El Paso and also fulfill our strategic plan that our Board of Managers just approved last month. It's our strategic plan from 2013 through 2018. So it's very excited, and I'm excited to share with you our presentation tonight. The title of it is UMC Coming Near You, Continuing Our Mission. And the title was arrived at and was created by J.O. Stewart and Ron Acton. J.O. Stewart, as for the audience, is the person that owned the property, that donated the property for the medical school on our campus. And Ron Acton has been one of our past board chairs, and they both came up with this title after hearing the presentation, UMC Coming Near You, Continuing Our Mission. The project itself is to develop outpatient destination centers. We call them destination centers because these are comprehensive centers, outpatient clinics, that will provide all services except for surgery or inpatient hospitalization. The goals of the centers are to establish clinics throughout El Paso, improve access to care. We all know in our community we have huge issues with access to care of our El Pasoans for health care in our community. This will address access to care. It will also address improvement of care, and also health outcomes will be improved. And health outcomes is important because health outcomes is how hospitals will get paid in the future. And we'll cover that more in the presentation. These next slides are artist sketches of the concept of the outpatient clinics. You'll notice that the colors, you'll notice that the structure, the colors, the material is similar to our main campus and also the Northeast clinic, and that's on purpose so that we can use branding for our locations and our facilities so that when El Pasoans come to our facilities, they know they're at a UMC clinic or a UMC location. Okay, the clinics, these are the locations: East, West, Central, and Northeast. They're 50,000 square foot. Those are the contemplated services from primary care. When I say primary care, I'm referring to internal medicine, family medicine, those services, nurse practitioners, physician assistants. Specialty care, I refer to specialty care, can be anything from cardiology to nephrology. Then we also have imaging, lab, pharmacy, and rehab, and they're going to be open all through the days, weekdays, weekends, and evenings. The locations are represented by the stars on the map. It's a little harder to see, but there's little circles on that map, on the El Paso map. Those little circles represent the clinics that we have today. The clinics we have today are much smaller in scale. They're from anywhere from 1,500 square feet to 10,000 square feet. In fact, the ribbon cutting that we just performed at Pelicano and George Dieter on the east side is 10,000 square foot. That gives you kind of a relationship. These clinics that we're proposing are 50,000 square foot, and they're large clinics, large real estate. They're 5 times bigger than the clinic we just opened up at Pelicano and George Dieter. We also have the property at all of the locations except for the east side, and we're in negotiations with the acquisition of property on the east side. So the west side clinic is on I-10, catty corner from Canutillo High School. 4 years ago we purchased property knowing that we would develop outpatient clinics. So we bought 13 acres on the west side for this purpose 4 years ago. Central, we also bought 5 acres north of the medical school, north of our campus, but south of I-10 for the same purpose, for expansion purposes for outpatient clinics. The Northeast, we purchased property in 2006, and we still have vacant property at that site in the Northeast. We have an additional 2.5 acres that's undeveloped in the Northeast. And on the East property, the location is 375, on this 375 loop north of Socorro Athletic Fields, and we're in negotiations to purchase that property now. The community support of this project is fundamental. We as a community have been working towards establishing a needs assessment, a strategic framework, the Medicaid waiver, and our strategic plan. All of these programs are building blocks and support this project, and I'll go into each one of these. This is the title page, the cover of the needs assessment. The needs assessment was adopted 2 years ago formally by our community. There were approximately 160 agencies involved, of all types of healthcare agencies as well as community leaders, city representatives, the commissioners, the mayor, the county judge, the El Paso state delegation. These were broad-based meetings receiving community input. They came up with this listing of important items for the community. These are the items that bubbled up for concern with the community that we need to focus on. With the entire goal is, how do we improve care? From the needs assessment came the strategic framework. Think of it as a strategic plan. This was adopted 3 months ago, was adopted last year. It was at a ceremony at the Art Museum. It was a celebration. All of the stakeholders signed the poster board in support of this strategic framework. The framework has 6 priorities. Listed on the first page are no surprises, from behavioral health to diabetes and obesity and nutrition. The priority area number 5 is what we're going to focus on for this project, and it's access to care. Access to primary care, access to specialty care. The third building block is the waiver, the Medicaid waiver. Medicaid and the reimbursement of Medicaid in the state of Texas is changing drastically. The UPL program that was in existence is no longer there. It was terminated several years ago. In its place, it's called the waiver. And there's 2 funding pools. One funding pool is the UC, uncompensated care, which will approximate the UPL revenue. The second is the DSRIP revenue. The DSRIP revenue, and think of it as this: the state government and federal government are saying, Jim, we want you to transform care in El Paso to make improvements to access and quality and improve health outcomes. So in the nature of this waiver, the government, both state and federal government, are giving us extra dollars to transform care here in El Paso. And I'll talk more about that. Hospitals will be paid on how well we accomplish this circle called integrated care. Everything from medical homes to access to health outcomes. So we will be paid, the government, both the state and federal government, are taking baby steps to change the reimbursement that we have today, which is fee-for-service. Over the next decade, fee-for-service will be reduced over time. In its place is how we get reimbursed by health outcomes and how well we put together this circle and implement it. This is just a small sample of a manual of the outcomes that we will be paid on. Hospitals and physicians and all healthcare providers will be paid over time by health outcomes. How do we keep patients out of the emergency room? How do we keep patients out of the hospital? How do we increase outpatient visits? How do we reduce complications and infections? How do we promote the outpatient visits? So all of these are items that will be held accountable for. And what the government is saying is that we're going to give you extra dollars, El Paso, Jim Valenti, to transform care in this community, but we have some hooks into you. The hooks are, we need to report on these outcomes twice a year, and we have to achieve them. If we don't achieve these, then we've risked the forfeiture of payment. So those are the hooks and the incentives through HHSC at the state level and CMS at the federal level. The waiver is state approved, federal approved, and we are serving as the anchor. It's an official responsibility. I am serving as the anchor executive for this community. The anchor executive is the facilitator of these projects of the waiver here in this two-county area, including Hudspeth and El Paso County. In addition, we have 26 certified participants. What does that mean? The certified participants are participants that have been certified through the waiver process to participate. They are involving the Medical Society, Texas Tech, the county health, the city county health department, the other hospitals in our community, home health agency, hospice agency. All of these are certified participants to participate in the waiver. And we're serving as the anchor. We've been meeting for the past year on a monthly basis. In fact, our next meeting is tomorrow. And so we get together and look at how do we transform care in El Paso to improve access to care, health outcomes, and quality of care. This is a map. Texas is divided into 20 regions. We're Region 15. The actual waiver was submitted 3 times, both in November and December and this month in February. It's 800 pages long. We've assembled 800 pages and it comprises 54 projects. I'm going to cover one project, but look at the focus. The project focus is outpatient care, primary care, specialty care, and health outcomes. And the state wants construction completed by year 3. We're in year 2 of the waiver. So that's important because we need to progress rapidly with the expansion of this project. This is an example of the waiver project. It's a great article that was authored and published in El Paso Inc. in November. Please reference that. It's a good article. It's a good primer on all about the waiver. This project involves UMC, the rescue mission, and the visiting VNA services. In this waiver project, we would have approximately 200 individuals, 200 families live at the rescue mission. It's downtown. About 250 ambulance trips would occur between the rescue mission and UMC, bringing their residents to our emergency room. The waiver project is we're going to put nurses at the rescue mission. So what does that do? Well, as a community, we eliminate 250 ambulance trips and EMT techs and ambulance crews, and they can be diverted to other locations or other assignments. In addition, we avoid the emergency room visit of 250 patients that should be outpatient visits. In addition, we save resources because we know emergency room treatment is 5 times more expensive than outpatient. So this is a win-win for everybody. Another project is the Salvation Army has close to 300 residents that live approximately 3-4 blocks from the hospital. We're going to put nurses there. So these projects are just one project of 54 projects that have been assembled and developed by all of the certified participants. And so this gives you a sample of how we're changing healthcare in El Paso. Our last building block is the strategic plan. The strategic plan, our goals over this next 5-year period is growth, market presence, leadership, our partners, quality, and advocate for the poor and underserved. No surprises there. Our strategies, the cornerstone is the outpatient centers. The outpatient centers serve and satisfy 8 out of the 10 strategies. And the strategies are primary care, emergency department in the Northeast, outpatient care destination centers, senior care, OB, improving OB care, enhancing our other clinical service lines, our relationship with Texas Tech, the patient experience, quality, and number 10 is operationalize the waiver. Those are our goals for the next 5 years, the strategies. I love pilot projects. I love experimentation. Nobody realizes in our community, but we were experimenting and had the first pilot back in 2009. We have a clinic up in the Northeast. In 2006, we bought additional property, 6 acres, because our clinic was at capacity. So we built, this is what we built in the Northeast. Lo and behold, it's 50,000 square foot. It's an outpatient center. Those are the services from primary care all the way to women's health. That's the picture of it. It looks just like the artist's rendition and our main campus on purpose. That's the branding. So it's all branded. That's the ribbon cutting back in 2009 with the dean and physicians and Commissioner Haggerty and other board members. Look at between 2009 and 2012. This clinic has been wildly successful. Patient visits have doubled. Laboratory has increased by 10-fold. Imaging has increased 5-fold. And pharmacy increased 30 to 40%. The other services weren't even present in 2009. So this clinic has been very successful as our experiment. How does this project help us? Well, it furthers our healthcare mission. The justification, it supports primary care and specialty care. It's 100% alignment with the needs assessment, the strategic framework, the waiver, our strategic plan, and it prepares us for the Affordable Care Act, ACA, otherwise known as Obamacare. So it prepares our campus. Without this project, we're not ready for Obamacare. We're not ready for the ACA. It's good for El Paso. When these are running full tilt, there'll be 200,000 patient visits. Our community is 800,000. Our MSA is 1.3 million. So it's going to help our community greatly with 200,000 patient visits. It'll help us achieve geographic coverage, which we do not have today. It also will support all of the patient, regardless of the payer source, from insurance to charity. We will provide 450 new jobs. Those are doctors and nurses and healthcare workers. These are good jobs at good pay with good benefits. It's clearly an important economic initiative for our community. It supports our teaching and education missions. We already enjoy high credibility for our value and progress, and it continues that. And it improves our overall patient experience with convenience, because we're going to be going and taking our services to the community. We have patients from Canutillo and grandmothers that come and take 3 bus transfers to UMC. Here, we're moving the clinics to their location. Think of this as branch banking. We know that there's a main bank and there's branch banks in the community convenient to patients. Same thing. Another good analogy is fire stations. There's a main fire station and then there's fire stations in our neighborhood. The same thing what we want to do here for El Paso. It's good for El Paso because we know outpatient care is less expensive. Emergency room, it reduces emergency room overcrowding and wait times. We know it's 5 times less expensive outpatient care compared to emergency room care. It cuts costs, saves resources, $17 million annually. How do I come up with that $17 million? We already know we have 20% of our emergency room volume should be outpatient visits. On the flip side, we know with 100 outpatient visits, you avoid 12 to 13 emergency room visits. So when you take those two factors together, on an annual basis, about $17 million in savings. We will also cover 100,000 new uninsured patients, which is huge in our community because we are one of the greatest counties in the nation, not just along in Texas, of uninsured and poor access to care. It's going to be better quality of life for all, and we're going to have healthier citizens with this plan. This is a quotation from Dr. Cunningham to the Subcommittee on Health at Washington. And the bottom line on this quotation is these clinics reduce ED overcrowding, improves care, and saves resources. It's good for UMC because we maximize the waiver, we prepare for the Medicaid reimbursement, we continue our momentum and growth on the campus, we improve our market share, our geographic coverage. Our clinics today are at capacity. We've opened up 3 this year because we're at capacity. It continues our census growth at UMC. It continues our hub and spoke strategy and improves the overall patient experience. It supports our fiduciary responsibility because we already know that we are at historic lows on interest rates and the municipal bond market is at record levels. We also, this complements our AA rating. We enjoy a AA rating. The rating agencies already have issued white papers. Their most recent white paper emphasizes outpatient care, outpatient programs like this. It continues our UMC's existing low tax rate. I have a slide that's coming up that will show you we are one of the lowest tax rates in the state. It promotes a multiplier, I'll cover that later, and it improves our campus market share and payer mix. The multiplier effect is $1 of taxation equals 7 UMC dollars. How do I do that? We collectively as a community pay through our property taxes $64 million for UMC. Then we turn around and generate $450 net revenue. That net revenue represents physicians, nurses, programs, and services. We are a strong economic engine to this community and one of the taxing entities that has a substantial return. Out of your dollar of taxation, where does your money go? 7 cents goes to UMC. When you pay your dollar in December or January, 7 cents goes to UMC. Twice that amount goes to the county, 4 times goes to the city, and $0.50 goes to the schools. We're a good value. This slide shows you the tax rate. El Paso is on the left side, left bar chart, and that's the average cost of the average property of 100,000 So the average citizen is paying about $224 for their family, that property, per year. On the far right-hand side, that 290, 289, 290 average is the average for the other communities. You can compare El Paso. We are frugal. We've been wise stewards of our community's dollars. And so we're one of the lowest tax rates in the state. Can we afford this project? Our current achievements, we've had 8 years of solid operating and financial performance. We've had 7 straight years of positive net earnings. We've received 2 bond upgrades from Fitch and S&P. There's only 4 hospitals in the nation that have received 2 bond upgrades in 3 years. So Wall Street is referring to as our plan is a solid and strong plan. Our progress is a solid, strong plan. And S&P just 2 months ago reaffirmed our rating with this plan in place. So S&P is aware of our expansion plan, of the expansion of outpatient clinics, and they've already come out and reaffirmed our outlook and our rating. We have one of the lowest tax rates that we've talked about, and we have a conservative fiscal policy. Our net revenue, this slide shows that our net revenue is growing over the next 4 years, and it also shows a modest net earnings. It's modest, but that's who we are. Because when you look at UMC, out of patients, half of our patients are unfunded, the other half are funded. And so that's how this works. So we're going to have a modest bottom line. The last year dips in 2016 because depreciation for the clinics will come online. So our plan is for 2013 to design the clinics, 2014 to build the clinics, and 2015 to open up the clinics. The outpatient care destination centers, that's a repeat of the slides of the services involved and the hours of operation. Be a positive effect to our net earnings. The capitalization plan. This bond issue is important for us to implement our strategic plan. It calls for $162 million of certificates of obligations. It requires the Commissioner's Court approval. We're looking, the first step was taken last week by the Board of Managers to approve a notice of intent to issue bonds. That occurred last week at our Board of Managers meeting. The month before, in January, the Board approved our 5-year strategic plan. So the Board approved our strategic plan in January, then approved last week on Tuesday our board meeting, our February board meeting, the notice of intent, and to forward that to the county commissioners. And next Monday, at the county commissioners meeting on Monday, the court will discuss and decide to issue a notice of intent, and that notice of intent to the public will be public notice to our community to issue bonds. That's the first step. And so we're going to continue to have public meetings through the month of February and March. By statute, 30 days after the notice of intent, then the county commissioners would decide to issue bonds. And that would occur in early April. So that's kind of the planning. And so the first steps have been taken last week. Today, we're in our 4th public meeting. And we've had strong support. And since January, I've been meeting with small group meetings, 1-on-1, 2-on-1, 3-on-1, 4-on-1, with community stakeholders, with individuals throughout our community, both elected officials and other community stakeholders of our community, city representatives, the county commissioners, the El Paso delegation members, and other leaders of our community, in addition to other groups. And so this is our fourth group, our public meeting. And we have public meetings scheduled throughout February and March. It's a highly favorable bond market and interest rates. The agencies, the rating agencies of Fitch and S&P will come to our community in March to give the rating to the bond issue. And then we sell bonds in the first quarter. So it'll be around the March, April time frame that we'll have the bonds. Here's the taxpayer investment. It's 162 million bonds. Our current tax rate is 19 cents. The bond project is 2 pennies. And a $100,000 home, it's $20 per year, or approximately $1.70 per month. That's the investment. In addition to what I've already talked about, there's a refinancing opportunity. Our 2005 bonds can be refinanced and we can save the taxpayers $7 million. Last week, that figure was $10 million because of the market improvements. So it's like your house mortgage. If you bought a house in 2005 and financed it, you're probably refinancing because the rates have improved so much. That rate on the 2005 issue is 4.8 interest. These bonds could be as 3.5 to 3.6 interest rate. So it's a good savings for our community, in addition to the project that we're talking about with the expansion of outpatient clinics. This is a project bond list from the West Clinic, the East, the Central, the Northeast, the medical equipment, the annex, and then the other projects. We still have floors that are 50 years old that need to be renovated and brought up to specifications. It's no different than your home. Our home is 50 years old. It doesn't look 50 years old because we have done a good job of keeping it clean and refurbished, but it needs to be improved in a major way, similar to what we've done to the other floors of the hospital. So that's the project listing for $162 million. And that's the picture of the clinics. And we appreciate the community's support. So thank you. This is Jim Valenti, President and CEO of University Medical Center.